Welcome back to my channel. So today I am going to be giving the WHO, or I'm going to be demonstrating the WHO recommended hand washing technique. You already know that this period we have to be intentional about so many things, our safety and for the safety of people around us. This is not the time to be careless at all. This is the time to be intentional, to be responsible, because we need to be safe. For every other person around you to be safe, you need to be safe. So the coronavirus is an infectious disease, and people that are infected with this disease are likely to experience mild to moderate respiratory illnesses. The symptoms could be cough, sneezing, fever, high fever, difficulty breathing. Of course, if you walk on altitude, you're going to have difficulty breathing. So how you could know that there's something wrong is when you begin to feel uneasy doing things that you would easily do without having difficulties. So then you begin to watch yourself, self-isolate. Now, older people and people with underlying medical illnesses like cardiovascular diseases, cancer, chronic respiratory diseases are more likely to experience serious illness. The best way to prevent this and slow transmission is to get informed knowledge. Get your facts right. Don't spread rumors. Get informed knowledge on how these diseases spread. Now, this can spread from droplets from saliva or discharges from the nose. It is very important that if you need to cough, please get a tissue, or you cough in your elbow. So get a tissue, you dispose of that tissue. Get your hand sanitizer handy. Get a small one that you can put in your bag. In your house, get one. And in your environment, we have to be very clean. We have to be very particular about things. You can get the Clorox disinfectant wipes. You need to clean everywhere because we all need to be safe. Now you wash your hands under running water. You wash your hands, you clean with, I recommend that you clean with kitchen towels. So immediately use kitchen paper towels. Immediately you use it, you dispose of it. You get your sanitizer, you sanitize your hands with. We have the NCDC toll-free numbers. You call the number if you start having any of all these symptoms, or you report to your nearest hospital and give them facts. If they ask you if you've traveled in the past 3 months or 4 months, respond well. Talk to them, give the right information so we know what next to do. So I'm going to be demonstrating the WHO recommended hand washing technique. Welcome back. Try not to dab or whatever, fling your hands. Tissue. Dispose. Then sanitizer. Alcohol based. See? Very easy. Very easy. It's also very important for us to practice social distancing. It means that you're not supposed to be in a gathering of more than 20 persons. In some countries, they're saying not more than 2 people should be found in a plate, and Nigeria is saying not more than 20 persons. That is not too much to ask. Avoid partying, avoid weddings, avoid going for burials. This is not the time to go clubbing. If you have to go to work, do your job, come back. If you are asked to work from home, work from home. Watch a movie, read a book, follow the news, do the important things. Don't visit anybody. Nobody should visit you if it's not important. So I hope this video comes in handy, and please let's all be safe. We have to be intentional about this. We have to take this seriously. And see you next time. Please subscribe and share. Bye.